Hello everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So I have already started with the lower limb session. Our today's topic is Dorsalis Pedis Artery. We will be learning this topic in 4 subtopics, that is introduction, beginning, course and termination, relations, branches as well as clinical anatomy. This is a short topic, it comes for 5 marks in the university exam. So let's start. Introduction. It is a chief palpable artery of dorsum of foot. It is commonly palpated in the patient with vaso-occlusive diseases of the lower limb. It is a continuation of anterior tibial artery onto the dorsum of foot. So it is a chief palpable artery which is found in the dorsum of foot. It is commonly palpated in the patient with vaso-occlusive diseases of lower limb. It is the continuation of anterior tibial artery. Its beginning, course and termination. It begins in front of ankle between the two malleoli. Then it passes medial side of dorsum of foot to reach the proximal end of first intermetatarsal space. Then it dips downwards between two heads of first dorsal interosseous muscle, then end in sole by completing the plantar arterial arch. So first it begins between the two malleoli, then in the medial side where it ends in first intermetatarsal space, then between the two head of first dorsal interosseous muscle, then ends in the sole by completing the plantar arterial arch. Its relation. Superficially it is related to skin, fascia, inferior extensor retinaculum, extensor hallucis brevis which crosses from the lateral to medial side. Deep capsular ligament of ankle joint, talus, navicular and intermediate cuneiform bone. In medial relation, it is related to extensor hallucis longus muscle. Lateral relation, it is related to first tendon of extensor digitorum longus and medial terminal branch of deep peroneal nerve. So this was all about the relationship. Now the branches. It has lateral tarsal artery, medial tarsal artery, arcuate artery and first dorsal intermetatarsal artery. Medial tarsal artery, lateral tarsal artery, arcuate artery and first dorsal metatarsal artery. Clinical anatomy. Pulsation of Dorsalis Pedis Artery are easily felt between the tendon of extensor hallucis longus and first tendon of extensor digitorum longus. It is congenitally absent in 14% of the subject. This is the diagram. Here we can see it is the continuation of anterior tibial artery. It has a medial tarsal artery, lateral tarsal artery, arcuate artery and first dorsal metatarsal artery. Dorsalis Pedis Artery, it dips deep in the sole and by completing the plantar arterial arch. So I hope you understand this topic. If you want such more videos, you can subscribe to my channel, and if there is any query, please do comment in the comment section. Thank you.